If you just had stem cells or you are about to have stem cells and you're wondering, what are a couple things I need to do? What do I need to be aware of in terms of the recovery process? And what do I do to ensure that I'm recovering at the best rate? Well, if so, this episode is going to be perfect for you. Are you someone who recently had stem cell injections, or are you preparing for one and you want to make sure you get the best results possible? If so, you're in the right place. My name is Dr. Chris Garcia, residency trained specialist and leading expert in stem cell recovery. I created this podcast to share those lessons and give you a clear roadmap to maximize your results. Welcome to the Stem Cell Recovery Podcast. Hi, everyone. Welcome back to the Stem Cell Recovery Podcast, episode number 2. First of all, thank you for the feedback, the love, the comments, the 5-star reviews on Spotify, Apple Podcasts. The feedback has been phenomenal. I'm doing this because I'm passionate about helping people just like you recover safely and properly and get the best possible outcomes after stem cell injections. So this is on to episode 2. You know, the reason why I do these episodes is because there's a mixed bag of feedback on what to do, what to avoid. So I wanted to help create a centralized place where you have medically backed, science backed information, so that way you can have the best route going forward. So here we are on to episode 2. Why did I create this episode? Well, if you are not in my Stem Cell Recovery Skool, Skool, you need to be. So you can go there, www.skool.com/stem cell recovery experts. But in school, I get a lot of questions. Should I be walking? How much should I be doing? I just had stem cells yesterday. What's the best process? And so I wanted to find or give you guys an easier framework to work off of. It's hard to answer everyone's questions because everyone's circumstance is just a little different. Some of you are getting into your neck, your back, your elbow, your knees, your ankles, your hips, and so there's a variety of things. So I wanted to provide a framework of the top 3 things that you need to do right after stem cell injections so that you feel prepared and you have a better route of recovery. So let's go through it. So the first one is, motion is lotion. You need gentle movement in this whole process. So what you need to understand is anytime you have stem cell injections into any joint, that joint has a normal pressure. And so it might not be used to that much liquid into a small space. So when you have liquid expand and push onto a joint surface, that tells the nerve receptors around there, oh, this feels like inflammation. So we're going to protect the knee and, stiffen it up or tell the back to not move so much. Well, there's this really fine balance on how much movement you should do. You definitely need movement. So stem cells come in and they create inflammation, right? Their job is to repair tissue. Your job is to create some good, gentle blood flow into that area. And if you don't, you're going to find yourself stiff with more inflammation, more pain than you had before, or you're actually going to feel worse. And so you want to find this balance of how much movement do I apply? Every time I move, it hurts. And so a good framework that I've given you on episode 1 and other resources is, about 50% of your activity level. Not including, your fitness and your work activity. I'm just talking about daily activity. So if you enjoy walking, if you enjoy walking your dog, doing just household things or gardening or whatever it is, you're going to cut the activity level by 50%. And this is just a simple, easy framework. You might say, well, I'm super active. I understand. I'm just giving you a framework in these first 2 weeks from day 0 to day 14, maybe even 28 on the 3 things that I recommend to anyone that asks me questions within school or the podcast or clients here at the Stem Cell Recovery Experts. And so motion is lotion. So you're going to have to find this framework. So the first one is gentle movement. And you need to figure out what is your threshold? You're gonna cut your activity level by 50%. Now, maybe you were doing 10,000 steps a day before. Maybe you were on your Fitbit or your Apple Watch or your Oura Ring, and you were very, very active. You're gonna cut that in 50%, and so now you're at 5,000. And you're like, well, great. I mean, that's great for a little while, but like, how do I get to move more? And so you want to do 10% increases. So now you're at 5,500. Now you're at 6,000, right? So every week you're advancing, and that way it's gentle movement. And you only increase when you don't have any increased symptoms from that same activity. So for instance, If you were walking and you were doing 5,000 your first week, and that seemed like your knees or your back was actually getting worse, then we're not going to move you up. We're going to keep you consistent. And so you need gentle movement. For many of you, it's the concern of, well, I don't want to mess anything up. And you don't want to push too hard because you just had this procedure that you don't want it to go wrong. So you don't want to push too much, but then you have to fight this battle of that knee, that back, that neck will get stiff if you don't. So there's this fine balance. And so you have to get some movement in you. So whether you're new to fitness and you're an expert or you're an expert, you need that motion. You need that lubrication in that joint. So gentle movement is a really, really good thing. So 10% increases. So maybe some examples that someone provided recently that we're working with a client. They mentioned that they've been doing water walking. Now, water walking would be something that if you have access to a pool, whether it's a local gym, your backyard, where you get in a pool and maybe you take off, you go into a pool and you get into it where it's kind of, around your belly button area. So when you get in a pool, the amount of buoyancy, how much your body is lifted from you is about 50% when you go to your belly button. When you go to your chest, about 75%. When you obviously go, to your neck or above, you're about 100% of your body weight lifted off of you. So the easiest thing to do is start at a very deep level and then kind of work your way down. So if you have access to a pool, water walking is fantastic. So if you're trying to reduce, you're trying to, feel better while you recover without the pain, without the stiffness, movement is your best friend. And there's going to be other strategies to do this. So gentle movement is going to be the number one. I know it doesn't feel, I know you're scared, you're timid, but gentle movement is going to be your best friend. And finding that threshold, that balance on how much to do is going to be where you need the most support. So if you're very independent, fantastic, go ahead and do it. If you are working with somebody, monitor that, ask them, how much can I push and pull now? Do you feel like I'm going over the edge? And that'll give you that comfort you're in the right direction. But movement is fantastic in those first 14 to 28 days. The second part, number 2, is respect the inflammation phase, the inflammatory phase. Now, this is that first 48 to 72 hours. For a lot of you, maybe you thought, man, I'm going to feel like $1 million. I'm going to feel like I'm 21 again or 15 again now that I have these stem cell injections. Well, that first 48 to 72 hours, your knee, your back, your neck, it's like a normal inflammatory phase. Imagine, you sprain your ankle, you fall off of a curb, you bruise your hip. That is uncomfortable, and that body is now responding with, what should I do? I'm going to process this new inflammation, but I'm going to push onto that joint space, tell those nerves that it's injured, and slow you down. So the inflammatory phase is tough. That those initial 72 hours. So that's why I'm saying gentle movement is a good light thing to do. So if you have access to the pool, if you have access to any other way to unload your body just a little bit, that would help. But nonetheless, movement is the solution to getting you past those first phases. So the inflammatory phase, like I said, is that 48 to 72 hours, but also you have this kind of 2-week window where the inflammatory phase turns into something called the proliferative phase. The proliferative phase is when everything starts to scar down just a little bit. You're going to have these new repair cells coming in and creating some more scar tissue and helping your tissues heal. But once you get past the 72 hours, you still have some of that stiffness, but you have now a little bit more freedom and wiggle room to move just a little bit more. But you have to understand, if your body pushes back, it's doing it because it's telling you you're having too much stress for how much you're allowed to have in that initial phase. Now, because maybe you've had surgeries before or you've heard of surgeries, those can have 3, 6, 9, 12 month timelines to recover. And because this is an injectable, maybe you've had cortisone or PRP, that those recovery processes were a lot faster, maybe 4 weeks, maybe 6 weeks, and you felt amazing. Well, this is an injectable. There's no incision. However, this is something that it is closer to surgery in terms of cellular healing. The cells themselves, what that process is, versus an injectable, which will be helpful with pain relief, maybe some PRP and get some cellular healing. But in terms of stem cell healing growth and how long, I think some of the studies that I've seen are 12, 15, 18 months of repair that they will continue working after the injection. So this is a longer timeline. not because of anything other than what it is that you're getting injected into the site and what the nature is of that stem cells do. So number one, follow the gentle movement, motion is lotion rule. Number two, respect the inflammatory phase. Pain is not normal in that when you move and you do an activity, pain increases. Now, for some people, I think what you have to do is you have to understand there's a difference between soreness and pain and stiffness. And so pain is typically, it hasn't got subsided after 72 hours. It happens on maybe one side, not just both sides, and it's limiting your ability to do things. Now, if you are having pain, you have to kind of bring your activity level back, less motion, respect the inflammatory phase, and respect the proliferative phase for 14 days. And for some people that you might think, well, gosh, I'm a very active person. If I just rest, I'm lazy. Well, it's not laziness in terms of this. It's very strategic in how you're planning your recovery process and how much effort you're putting into this. You have to be very diligent. And this is all about following the process and a roadmap versus doing nothing and just seeing how it goes. And so if you've taken that approach before, this is a vastly different recovery process. So you have to do this properly. And if you were to, start to do more and you feel a little bit of inflammation or pain or discomfort, okay, you've reached your threshold. Give yourself 48 to 72 hours and see how your body responds. If it creates stiffness, soreness, swelling, then that's your signal to pause. Stay there. Stay at that activity level. Do not increase until you can start doing more things without 48 hours of, worsening. That's telling you you're on the right track. Okay, so number one, motion is lotion, gentle movement. Number two, respect the inflammatory phase, those first 72 hours and into the proliferative at 14 days. And the last one I have is, don't chase the pain. And what I mean by that is, there's two ways that your body adapts to things, and that's how much stress is applied. So for instance, if you go to the gym and you do some bicep curls or squats or something, your body's going to adapt with bigger muscles or stronger tendons and doing those things. But it's also going to adapt by how much you recover afterwards. So for instance, if you sleep a lot and you're eating you're staying hydrated and you're eating properly, it's going to adapt by building those stronger tendons and muscles. Now, going to the gym and adding more stress without proper sleep and nutrition is not going to be a good equation. So you want to have the amount of right stress, but also the right amount of recovery. So when you are recovering after stem cells, there's already an inflammatory phase happening in those first 72 hours into the proliferative phase at 14 days. Now, if your body's already recovering from the inflammatory phase, it doesn't make sense to add more stress, or else you're adding stress on top of stress, and that's going to create more inflammation, and that's why people have a delayed recovery process, because they're adding too much stress during this time. So initially, your goal is to maximize recovery, which is counterintuitive because you've always focused on the thing that makes you feel better, the dopamine, those things that you love to seek out, right? The running, the pickleball, the playing with your grandkids, all those activities are great, but they're physical stress to your body. So you have to focus on the recovery side because there's already stress going on, and that for a lot of people slows you down. You're like, well, I've never been able to sit down. Nothing has ever limited me from doing things. I've always been active. Well, stress is not what you can attack right now. Recovery is the thing you can attack. So that's going to be your sleep. That's going to be your hydration. Your positioning while you sleep. If you've had it to your back, you're probably gonna have to sleep on your side, or if you've had it to your knees, you're gonna have to sleep with your knees slightly bent, or if you've had it to your shoulder, you might have to be in a recliner. In either case, you're adapting without adding more stress. This is the most frustrating part afterwards in those first 14 days, is that you are trying not to, you're trying to figure out, well, how much activity do I do without adding, more inflammation or more swelling. So for a lot of you, you have to, instead of focusing on, well, what can I do? Well, what can I do to recover? Not what activities can I start now? So first 14 days, work on the recovery process, not adding more stress. Hydration, sleep, and finding a good, comfortable sleeping position. So if you do less in those 14 days, It'll protect a lot of your recovery process. So for a lot of you, it's a huge investment, time, money, resources. If you're asking, well, what should I do in 14 days? Do less than you were previously doing. Slow yourself down. Have a little bit of light activity, and then respect that inflammation phase and the proliferative phase. So those are the three things that I would have anyone doing right after stem cell injections. Now, there's going to be a lot of questions on, what about my case? Can I do this? Can I go to the gym? This is just a general framework. Get some movement in, respect the inflammatory and proliferative phase, and don't change the pace. Don't chase the pain, and focus on recovery. Those are really the glue to your first 2 weeks. But then, if you find yourself stuck and you're wondering, okay, what do I do? I think if you just understand the timeline, the framework, the process, that is what you need to do. All the questions that you have. Well, what about my, inflammatory disease? What about my diet? What about my knee? What about the gym and the lunges and all those things? Those need to hold. The biggest priority is, how do you let your stem cells do what they need to do so you don't aggravate them, inflame them, and distract them from what they're intended to do. So understand the process, understand the timelines, the framework. And for those of you who need that, I do have a stem cell recovery protocol that I'm happy to provide for any of you who need the support. And if you want more support, more resources, join my free Stem Cell Recovery School. It's where I have the post-stem cell recovery process, more in-depth videos, resources, logs, handouts, mailers, whatever it is that you need. But ultimately, it gives you that comfort, the confidence. And for a lot of you, that's what you're lacking. You're like, I don't know what that process is. I'm concerned. I'm scared. I'm not sure if I'm on the right track. I don't trust my doctor. I don't trust my PT, or I love my PT. I don't trust my doctor, or vice versa. And for a lot of you, you're in different scenarios. I've heard it. I've been doing this for many years. I've heard all the scenarios and stories. And if I can give you the top three things, I would say stay mobile, respect those first 2 weeks, and then focus on the recovery process and less on the stress accumulation. And that puts you in a good position to then skyrocket afterwards. And so for a lot of people, they struggle in those first 2 weeks because they didn't know this. They flare themselves up and they feel stiff, and so they find themselves even more concerned about, did I do this wrong? And so that's where the phone calls, the late nights, the thoughts, everything else happens. But once you understand the framework, it's not so hard. Now you're just managing, okay, how do I get through this timeline so I can start my next one? And that is the peace of mind you get. So I hope this helps along your stem cell recovery journey, the three things to do right after. If you have any questions, go ahead and message me, email me, find me in the Stem Cell Recovery School so I can help you along your process and ensure that you're getting your life back and you're living your absolute best life. So that is it for episode 2. I will see you guys on the next episode. Take care. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on recovering safely to create long-lasting results after stem cell therapy. Thanks, and I'll see you soon.